South Korea continues to see a downward trend in the number of COVID-19 cases, even after the lifting of the indoor mask mandate. However, the authorities say it's not a time to let guards down, considering rising reinfection numbers. Jeong Eun-joo with more.
South Korea's overall downward trend in new COVID-19 infections continues despite the country lifting most of its virus curves. The government lifted the mask mandate for indoor spaces, except at hospitals, pharmacies, and on public transportation on January 30th. The Korea Disease Control and Prevention Agency said at Wednesday's briefing that the number of new cases last week decreased by 24% compared to the previous week. The agency attributed the decline to the high level of voluntary adherence to COVID-19 preventive measures. The country also added fewer than 20,000 new cases for the 7th straight day. There were 22 COVID-19 related deaths, and the number of critically ill patients was down 10 from the previous day to 283. The nation's COVID-19 reproduction index is at 0.90, below 1 for 5 consecutive weeks, indicating that the spread of the virus has decreased. Weekly COVID-19 risk levels were also at low nationwide for the first week of February. Presumed cases of reinfection, however, slightly increased from 22.8% to 23.03% in the last week of January. This means that 1 in 4 to 5 confirmed cases had already caught the virus before. Health officials said that the immunity of those who were infected during the spread of the Omicron variant may be decreasing and urged people to get booster shots. Meanwhile, Jeong-mi, commissioner of the KDCA, said Tuesday that South Korea is considering lifting visa restrictions on travelers from China earlier than scheduled, as China has seen a steady decline in the number of COVID-19 infections. Those entering South Korea from China will still be required to undergo a coronavirus test before and after arriving until the end of this month. Jeong Eun-joo, Arirang News.